Phytoestrogens are dietary bioactives, and they're natural compounds found in some plants, and they're similar in structure to estrogens. Although several types of plant compounds are classified as phytoestrogens, the most studied of these are the isoflavones and the lignans. Phytoestrogens in plants are largely inactive, but they are metabolized into active compounds by the intestinal bacteria. Once absorbed, the activated phytoestrogens exert estrogen-like effects in the body, and they may be an alternative to the bioidentical hormone replacement therapy for some women. Some of the best evidence to support the use of the phytoestrogens comes from Asia, where menopausal symptoms are milder and less common, and breast cancer incidence is lower than in Europe and North America. One explanation might be the phytoestrogens found in soy and other plant products commonly consumed in the Asian diet. Phytoestrogens bind to the estrogen receptor and they modulate estrogen activity. The estrogenic effect of the phytoestrogens vary, but it's generally weak relative to estradiol. In the presence of estradiol, they appear to have anti-estrogenic effects as they compete with the estradiol for the estrogen receptor binding sites. Phytoestrogens have also been shown to reduce menopausal symptoms, and they might decrease the risk of some chronic diseases, including cardiovascular disease, osteoporosis, and breast cancer. Intriguingly, phytoestrogens seem to preferentially bind to the estrogen receptor beta, as opposed to the estrogen receptor alpha, and this is more strongly activated by estradiol and some other mammalian estrogens. The estrogen receptor beta activation has been proposed as a mechanism for preventing the emotional and neurological aspects of aging and the menopause, and it appears to protect against cancerous changes in breast, ovarian, and possibly other tissues. Dietary and supplemental phytoestrogens present a way for women to obtain limited hormonal support without the use of hormone therapy. Unlike conventional hormone replacement therapy, which has been shown to raise the risk of heart attack among postmenopausal women, phytoestrogens appear to have a positive effect on the heart. In 1999, the FDA authorized the use of health claims on food labels that link increased soy consumption with a reduced risk of coronary artery disease. There's many studies examining the cardiovascular effects of phytoestrogens. Overall, research suggests the isoflavones might lower high blood pressure, improve lipid disturbances, lower homocysteine levels, improve vascular health, and prevent atherosclerosis. Lignans similarly have been associated with low blood pressure, improved lipid metabolism, and reduced cardiac risk. In addition of their ability to weakly activate the estrogen receptors, phytoestrogens have strong anti-inflammatory and oxidative stress reducing effects, which might contribute to their cardiovascular benefits. Estrogen and estrogen-like compounds protect the brain cells from degenerative changes due to aging, oxidative stress, and stroke-induced damage. Several studies have shown the phytoestrogen genistin protects experimental animals from the effects of brain ischemia, the kind of injury seen in strokes. In addition, the genistin has demonstrated anti-apoptotic activity, protecting the cultured brain cells from self-destruction over time. A number of studies have been conducted on phytoestrogens and bone health. Clinical trials have found phytoestrogens can increase bone mineralization, reduce bone reabsorption, enhance bone formation, and improve markers of bone metabolism. Taken together, their findings suggest the phytoestrogens, mainly soy foods and isoflavones, can help to mitigate the bone loss after the menopause. A number of studies have noted an association between isoflavone consumption and decreased breast cancer risk. Soy isoflavones are safe in women with a high risk of breast cancer, including breast cancer survivors, and they don't increase the risk of uterine cancer. In addition, flaxseed, which is high in phytoestrogenic lignans, has been shown to reduce breast cancer risk and reduce the breast cancer tumor growth. Phytoestrogens may protect against breast cancer in part by improving the estrogen metabolism. A diet containing 113 to 202 milligrams, depending on body size, of genistein and dydson was found in a trial to increase the ratio of the protective 2-hydroxylated estrogens to the harmful 16-hydroxylated estrogens in the urine of premenopausal women, an effect that might contribute to a lowering of the long-term risk of breast cancer. Furthermore, emerging evidence suggests the phytoestrogens inhibit aromatase, which is the enzyme that catalyzes the conversion of testosterone into estrogen, and this effect might contribute to their association with the lower breast cancer risk. Lignans are phytoestrogens and are found mainly in flaxseed, with a small amount occurring in sesame seeds, some sprouts, and many other plant foods. A comprehensive review of 21 studies found postmenopausal women with higher lignin intake were significantly less likely to get breast cancer. In one clinical trial, 32 women awaiting surgery for breast cancer were randomized to receive a muffin, either with or without 25 grams of flaxseed. The analysis of cancerous tissue after surgery revealed the markers of tumor growth were reduced by 30 to 70% in the flaxseed group, but not in the control group. A study published in 2010 found a combination of lignans, I3C, and calcium D-glucarate, along with other herbs, favorably altered the ratio of estrogen metabolites in 47 pre- and 49 post-menopausal women. Several studies have demonstrated that natural phytoestrogens can improve the menopausal symptoms, particularly hot flashes. A comprehensive meta-analysis that included results from 17 clinical trials found that the treatment with an average of 54 milligrams of genistein per day for between 6 weeks and 12 months safely decreased the hot flash frequency by 20% and the hot flash severity by 26%. A special extract from Siberian rhubarb has been used in Germany for decades to treat problems that are related to female hormone imbalance, including infrequent or absent menstrual periods or peri- and post-menopausal symptoms. In the first randomized control trial using the supplement, 109 symptomatic perimenopausal women were given either an enteric-coated tablet providing 4 milligrams per day of the standardized Siberian rhubarb extract or placebo for 12 weeks. After 4 weeks, the menopause-related symptoms diminished significantly more in the Siberian rhubarb group when compared to the placebo, and by week 12 the difference was even more pronounced and was measurable for each of the 11 symptoms considered in the trial. A clinically meaningful decrease in symptoms was reported by 45 out of the 54 women who were receiving the extract, or 83%, and 1 of the 55 women who were receiving the placebo, which is less than 2%. Furthermore, extensive investigation into the possible adverse effects attributed to the Siberian rhubarb found there was none. A subgroup of participants that then went on to use the same extract in an open-label trial for 48 to 96 weeks. In general, these women experienced continued improvements in their menopausal symptoms with no adverse side effects. Another study using the data from the initial trial found the standardized Siberian rhubarb extract was more effective than a placebo, specifically for relieving the menopause-related anxiety and improving the general well-being. In 33 of the 39 rhubarb-treated women, whose anxiety was severe or moderate at the beginning of the trial, the anxiety was reduced to slight after 12 weeks. The study also noted a correlation between the decreased anxiety and the reduced hot flashes. Treatment with the extract led to a decrease in overall menopausal symptom scores, as well as reductions in individuals who had their symptoms tracked in a 6-month open-label study with 363 participants, and a 12-week randomized control trial with 112 participants. Lab research has revealed the Siberian rhubarb and its active components selectively activate the estrogen receptor beta, having no effect on the estrogen receptor alpha. The estrogen receptor beta activation was proposed as the mechanism for preventing the emotional and the neurological aspects of the aging and the menopause, and it appears to protect against the cancerous changes in the breast, ovarian, and possibly the other tissues. Black cohosh root has a long history of traditional use for treating gynecological disorders and has become a popular herbal medicine for relieving the menopause symptoms. Randomized control trials have demonstrated its efficacy for treating the menopause symptoms like hot flashes, low libido, sleep disturbance, and other physical and emotional symptoms. Black cohosh has a track record of safety, and the preponderance of evidence supports its use in treating the menopause symptoms. Black cohosh and closely related species have conveyed anti-proliferative effects on breast cancer in the lab, and the use of black cohosh is not associated with increased breast cancer risk or recurrence rates. Data from one clinical trial and several animal studies suggest it's comparable to estradiol and another anti-osteoporosis medication for preventing bone loss. Dong Qi, or Angelica sinensis, is used in traditional Chinese medicine for gynecological symptoms such as painful menstruation or pelvic pain, recovery from childbirth or illness, and fatigue and low vitality, and is therefore referred to as the female ginseng. Randomized control trials have shown the Dong Qi, in combination with other plant extracts, can relieve the symptoms of the menopause, and in one animal study, the Dong Qi was as effective as estradiol at preventing bone loss. Licorice root exerts estrogen-like effects with selective activation of estrogen receptor beta. Lab research suggests the licorice constituents inhibit serotonin reuptake, an effect that can contribute to its positive impact on the menopausal symptoms. In a randomized control trial, the treatment with 330 mg of licorice root 3 times per day reduced both the frequency and the severity of menopausal hot flashes more than a placebo during 8 weeks of treatment, and for 2 weeks following the end of treatment. Licorice root constituents have also been shown in the lab to support arterial and bone health, thus reducing the risk of cardiovascular disease and osteoporosis. Herbal formulas containing extracts of Vitex agnus castus, also known as the chasteberry, have been shown to improve menopausal symptoms such as sleep disturbance, hot flashes, and psychosocial wellness. Vitex, obtained from the dried fruit of the chaste tree, has been used in the context of women's health for centuries. It's been shown to modulate the hormonal and neurotransmitter signaling and to relieve premenstrual symptoms in several small studies. Lab studies have shown the compounds in the Vitex can bind to estrogen receptors and modulate hormone-responsive genes. Vitamin D appears to confer significant protective effects against breast cancer. Women with higher vitamin D levels had nearly a 70% reduction in their risk of breast cancer compared to women with the lowest levels, while another study linked low vitamin D levels with reduced survival in breast cancer patients. Lab studies have shown that vitamin D suppresses the growth and the development of breast cancer by blocking the signals that stimulate cancer cell growth, enhancing signals that inhibit cancer cell growth, modulating mammillary gland sensitivity to carcinogenesis, and inducing cancer cell death or apoptosis. Cruciferous vegetables such as cauliflower, cabbage, kale, and Brussels sprouts contain compounds that can help to detoxify estrogen breakdown products that promote cancer growth. One such compound is I3C, and this prevents the conversion of estrogen to the breast cancer promoting metabolite 16-alpha hydroxyestrone, while increasing conversion to the cancer fighting metabolite 2-hydroxyestrone. Fish oil, with its high omega-3 fatty acid content, reduces the cancer risk by a number of mechanisms. It reduces oxidative stress, and it suppresses the production of many inflammatory mediators that contribute to cancer development. It can sensitize tumor cells to chemotherapy's effects, even when the metastases are present, potentially reducing the dose of the chemotherapy required for the treatment. In an animal model of breast cancer, The fish oil supplementation was shown to reduce bone metastases. Green tea polyphenols, particularly one called epi-galligo-catechin gallate, or EGCG, suppressed the growth and the reproduction of human breast cancer cells in the lab, and it reduced the number of breast cancer tumours in animal models of the disease. The green tea also inhibited the production of tumour blood vessels while downregulating the cancer-promoting estrogen receptor and increasing apoptosis. For more on herbs, supplements, and natural treatment plans, check out my website.